Medurstand. Understanding medicine.
Professor Aziz or Rehman again, and I'm going to demonstrate the use of a thermoscope. It's a great instrument and every physician need to own one and carry with him all the time, especially if you're attending the emergencies. Sometimes it can give you very useful information. And this is handheld battery-driven thermoscope, and there are some wall-mounted units also, but this is a small handy one. So first of all, you need to understand the thermoscope itself. This is the handle and it also holds battery. There is a switch here and you can put it on and then rotate it to increase the intensity of light. Then we have this button, you can increase the diopters plus or minus, and then you have this button where you can have change the refraction also, and this is the viewfinder you will see through here. And of course there is a lid, you first have to uncover it, and at the moment it is covered, so I'm going to uncover it. And then you need to understand these. I think standard of thermoscopy is done at this position, the big circle, you see a big field. Then there are some specialized function for other things. I think I'm going to skip that. So let's do this. You hold a thermoscope in your right hand and examine his right eye with your right eye. Okay, so and you do both of them. So I'm going to take off my glasses. And whenever you are doing a thermoscopic examination, ideally, number one, I think ideally it should be a dark room. And ideally pupil should be dilated with mydriatic substance. But in busy clinics, we don't have much time to do dilatation. Brief of thermological examination, of thermoscopic examination is possible without dilatation of pupil also. So I think I'm going to do both eyes one by one, and first I'll do his right eye. So what I'm going to do is I'm going to hold the thermoscope in my right hand and I'm going to use my right eye to look into his right eye. And I think I normally hold the head like this. So, and we need to tell the patient to focus and keep looking at something. आपने उस घड़ी पे देखते जाना, वो जो घड़ी उस पे देखते जाना. So patient should be instructed to see at something which is at distance and ask him to fix his vision there so that eye doesn't move when I examine. And then I put the thermoscope on. So this is on, you can check the light like this, it's on, and I'm going to, first light should be less in intensity. I can adjust the light like this. So I will start the examination with low intensity so that he does not react to light. His pupil doesn't constrict in response to light. So low light, and as I approach like this, and I'm looking at his pupil, and when I approach, udhar hi dekhte jaye, and have to keep telling that he should see there, and I'm approaching him, and like this, get as close as possible. Literally you have to touch patient's body. This is what you have to do, though it might not look very aesthetic, but this is what you have to do, like this. So I have gone very close and I am now looking through his pupil to the retina. So first of all, you have to recognize the optic disc, which is the most easily identifiable structure in the retina, and then you move little laterally and identify the fovea, and then the macula, and then you see the whole retina like this. Udhar hi dekhte jaye. So I'm moving myself and my stethoscope this way. I'm seeing the upper part, the lower part, the medial part, and the lateral part. So this is how we complete the examination of retina. And then I'll move to the other side. Now I'm going to examine his left eye. I think it would be convenient if I hold the thermoscope with my left hand and use my left eye, so that it doesn't, my face doesn't obstruct the vision. So again, I will move from the distance. उधर देखते जाएं, like this. I'll move closer, and through his pupil, I'm looking at the optic disc. Get as close as possible, looking at the disc, then moving in all directions, and to see if there's any abnormality. There's some principles of ophthalmoscopy. When you are doing it, you must keep reminding the patient that he or she is supposed to look at distance. Patient should not be looking into this light, because that will initiate accommodation reflex, that will lead to constriction of pupil, and your retina will be out of focus. So it is built in a way that if your vision is 6/6, patient's vision is 6/6, and you have set it at 0, and then the retina should be in focus. And I think this is the technique, and since patient has a tendency to move his eye, then you have to keep reminding throughout the procedure that patient keep looking at the distance. There's a lot of information you can get from ophthalmoscopy. You can see the optic disc, if there is papilledema or optic atrophy, very important sign. Then you can see macular degeneration, which is common in elderly. You could have some idea about glaucoma if the optic disc is curved inward, concave, or papilledema if it is swollen. You can see hemorrhages, which may be a sign of hypertension, or exudates in diabetes, some leukemia disorder. So it's very, very useful technique, and you need to learn. Of course, we have to refer the cases for detailed examination of the retina to our ophthalmologist colleague, but I always say that every internist must know the basics of ophthalmological examination using ophthalmoscope. It's a great tool. Thank you.